startups have revolutionized the healthcare delivery process for better patient experiences. The Indian healthcare system is witnessing innovative disruptions that are solving big challenges of the healthcare systems like affordability, accessibility, and availability. Through this series, like Healthcare Startup Series, which is initiated by our MediCircle platform, which is a healthcare media platform. Through the series, we aim to raise awareness about the impact of this initiative, the latest developments going on this front, especially how healthcare startups have contributed to the overall growth of the Indian economies, and also the areas. Let's discuss about that also, like what kind of where the areas are which actually need some scope of improvements are there. So hi, this is Smita Kumar, and today in this initiative, we are going to speak to Adarsh Natarajan from AIndra. Armed with an experience of more than a decade in multiple companies across various geographies and an MBA from IIM Bangalore, Adarsh is our guest today. He took the entrepreneurial plunge and he started AIndra. So his passion in leveraging deep tech to solve hard human problems, which is really the start reason of why a startup should be started. And he saw him starting AIndra Systems, that is, and then he keenly got interested in entrepreneurship. He's closely associated with entrepreneurial ecosystem through various forums like the Startup Leadership Program, a global entrepreneurship a program for practicing entrepreneurs. He is also a part of close group of entrepreneurs which experiments deeply in the area of customer development using lean methodologies. So hi Adarsh, welcome to Healthcare Startup Series at MediCircle.
Hi Smita, nice talking to you. Thanks for giving me an opportunity to talk to your audience as well.
Sure. So we are pleased to have you here because we want to know more and more what especially the Bangalore-based healthcare startups are doing, because it is like the startup hub of India. So to begin with, Adarsh, as a report of IBEF estimates the Indian healthcare industry to be worth around $372 billion by 2022. And healthcare is possibly the most varied sector with startups categorized across so many categories, starting from telemedicine, online pharmacy, personal health, fitness, wellness, home healthcare, because now wellness has definitely included. Earlier, it was more about when only sickness thing was like considered, but post-COVID people are getting up and they are realizing to the facts of how to keep well, how to keep safe and secure, and how to be healthy. So there are a lot of home healthcare things, now medical devices which are wearable and people can also check their own health vitals. A lot of startups have also started in biotech and R&D, some in genomics and biopharma. So in your view, how are the Indian startups contributing to the social and economic growth of India?
Absolutely well captured, Smita. I should say, as you rightly mentioned, there's a wide spectrum of startups, all the way from pure play internet player pharma delivery, right? All the way to really deep tech startups who are also into drug discovery. So if you would look at the gamut of companies, they're spread across this entire spectrum. And therefore, the complexity also of all of these startups operating in the space kind of varies across this entire spectrum, right? And in terms of the contribution that startups are doing, I think, needless to say, we've seen an explosion of startups across this spectrum in healthcare. I mean, I'm not even going across the other sectors as well, but even in healthcare, there's been an explosion of startups working in different areas along the spectrum. And I think it is wonderful. It's a great time when we see a convergence of a lot of technologies that are available out there being purposed or being leveraged for healthcare, and that's kind of bringing or ushering in a new generation of products and offerings in the healthcare space. So this could mean even from speeding up the entire cycle of drug discovery, drug delivery, pharma, for that matter, when we're talking about distribution of drugs, medical devices. So we see that there is innovation happening in every point along this spectrum, and I think, needless to say, it is the startups which are actually working in each of these areas, which are continuously innovating in all of these areas and kind of bringing in those next gen technologies, next gen offerings that countries like India can use to leapfrog, and leapfrog into the newer technologies, not really going through an evolutionary phase, but directly leapfrog into the next phase of healthcare.
Definitely. So tell us more about AIndra, like what is it, what kind of products and services they are offering, and how it is actually disrupting the Indian healthcare ecosystem.
Right. So we also started, of course, we're also in the spectrum of healthcare, specifically in medical technologies. We develop, through a very strong AI engine that's central to our offerings. The whole idea was to use computational pathology as a means to take detection of certain critical illnesses to the point of care. And when I say computational pathology, pathology has existed many decades, where it is a science of looking at biological samples under a microscope and analyzing what is wrong with the subject. Now, there have been recent advances in this field, starting with digital pathology, which is actually converting the biological sample into a digital format and then analyzing, a pathologist still analyzing on a we have added computational means on top of digital pathology, meaning that we've employed technologies like deep neural networks and other AI related toolkits to kind of enable a more intelligent system than just digital pathology. So essentially, what we are doing is creating systems that will help us disaggregate the entire system of detection of critical illnesses. Today, if anyone has to go get themselves tested for certain conditions like cancers, they have no option but to go to a large tertiary oncology hospital, give their samples, get tested. We want to kind of change that paradigm and make this testing available in your neighborhood, in your local physician's clinic as well, right? So the first step to a good health starts with actually understanding about your own health. I think that is where detection of early on
Sure.
determines the of life that we have, we call as quality of. So essentially, for any system, always better than, right, and therefore to the prevention part, the treatment, or and that is will act show good health outcomes. And the way we think that is by going closer to the customers or going closer to the people and enabling them to get themselves tested in the neighborhood itself. So that's what we do. And for this, and we detect multiple kinds of cancers, cervical cancer, primary ones that we started with. But our offering now includes for cervical cancer, for prostate cancer, for oral cancer. So essentially, all of these cancers can be tested using platform in even in small healthcare units, and not necessarily only through tertiary oncology hospitals. So we have an end-to-end system that allows us to do this, Smita.
So like if how is
Long
that?
answer for your question.
Yes, so how, no, one more question attached to this. Like suppose if a patient visits any oncologist, like a consulting specialist, and the doctor asked for a diagnosis to be done. So if the system is there with the doctor, the diagnosis can be done there, and it would be actually fast forwarding the entire diagnosis process, and it would be like saving lot of time, and I think eventually lot of lives.
Absolutely. No, you got that bang on. Studies have shown that the compliance rate for any recommendation drops by about 50% if the recommendation is not given immediately to the patient who's been detected with a condition. Meaning, let's say a patient walks into a local physician's clinic or a gynecologist clinic, and if the gynecologist then refers the patient to a hospital or a laboratory to get herself tested and then come back with the results, there is a possibility of that there's a drop off happening, and therefore the woman who might have potentially had a condition goes on to live with that condition for long enough, and unfortunately during time is of essence in many of these conditions, and survival rates dramatically drop. So the whole idea being that if something is immediately available in the gynecologist clinic itself, the test can be done immediately, the result can be shown to the patient immediately, an immediate recommendation for further action can be given to the woman, and compliance is going to be pretty high in such circumstances. So that essentially is how not just the logistics of the patient going back and forth, but also the compliance improves greatly, and therefore having a positive impact on health outcomes.
How easy is the system for the doctors to use actually?
Oh, it can be, it is designed and developed keeping in mind a low skilled worker also being able to use the system, right? So India is a country where we don't have enough number of skilled people available, and therefore it is very important. It was very important for us to keep that in mind when we design the system. So therefore, it is a paramedic or a simple nurse or even a technician who's available in the physician's clinic can do this with about half a day training. So it's as simple as that.
Okay. And Adarsh, moving on to our next question, how COVID has impacted your business, your patient experience, especially? Like what kind of changes or experience you have experienced, especially post-COVID era?
So the COVID phase has been both, we've seen both dark clouds and silver linings, if I have to say. The dark clouds have been that most of the patients have put off their immediate, any other condition, right? The focus shifted away from any other condition and all towards COVID. So a lot of these procedures and processes and tests that were happening regularly, everything got disrupted and then kind of got pushed because of the fear of COVID or fear of walking into your healthcare unit, because of cross infections and things like that. Many patients preferred not to, go to regular hospitals and clinics and pathology labs, and that definitely also impacted us. But I think the availability of a telemedicine angle to our whole offering, where we also have a telepathology part, meaning that a sample that's been extracted from a patient in one part of the country could be seen and reported on by a pathologist sitting across anywhere, kind of worked in our favor, because we had actually labs reach out to us and say that our pathologists are, we want to keep them safe by not having them come into our laboratories. So can they actually report sitting out of their homes, if you can, digitize our samples? So in a way, while patients had a reluctance to come to the labs, on the other side, we saw some behavioral shift happening where pathologists wanted to also work from home, which is something that you wouldn't expect a pathologist to do, right? I mean, working from home is so much of a IT concept that it is difficult to do that in the healthcare, but that is something that telemedicine actually allows.
Okay. Just a quick question, Adarsh, like as you discussed earlier, so is AIndra still bootstrapped or you have got investments, and what are your expansion plans?
Oh, we have raised funding from multiple sources, and as I was mentioning, any startup with growth and expansion plans is always looking for funding, which will help us to accelerate that whole growth, and so are we as well. So our expansion plans, of course, not just India, we're looking at markets outside of India as well, and in due course of time, we would be entering into multiple markets.
That's great to know. So let's just have a quick advice from Adarsh Natarajan, what he would like to suggest to these younger generation who actually want to start up a healthcare startup.
So, I mean, I'm sure most of the entrepreneurs who are starting off now would have heard this from multiple various sources as well, and advisors and mentors. I think it is imperative to get out of the building, understand your customer's need before you even start conceptualizing and building anything. Secondly, domain expertise is everything in the healthcare world. So get some really good domain experts to be either advising you or on your board or part of your company. I think these two things need identification, and having domain experts at very early stages is an imperative. Of course, at different stages, different things become more important. But I think for early stage startups, that's a make or break kind of a situation.
So that was some golden words from Adarsh Natarajan to all those who are actually venturing out to start up a healthcare startup, especially. So thank you so much, Adarsh, for joining us at MediCircle today for this healthcare startup series. We wish you all the best, and also AIndra, that it actually raises more and more funds and is actually benefiting more and more patients, because early detection and intervention is actually needed in today's scenarios. Lot of the most important thing that others just mentioned, that there are so many, I mean, as of I think 50% patients cases, they don't actually turn up to the consultant again just because they have been advised a diagnosis, and it actually gets either delayed or postponed. So if that process can be fast forward, if that process can be accelerated, it would be really beneficial, and would be definitely, you would be able to screen more and more critical cases, and that would save lots of lives. That's really, really great to know about AIndra and also others. Thank you so much for joining us.
Thanks a lot, Smita. Thanks a lot for having me talk to you.